So good afternoon. My name's Katie, and I am a social worker at the VA Western New York Healthcare System. And Kathy had asked me to come talk because myself and another social worker by the name of Chris Ramnoth started a new role within VA within our suicide prevention team. Just wanted to start a little bit with some statistics, but this is a map of the US that shows rates of suicide by state. So we have a lot of national data within VA, which is really helpful, but sometimes our more local data is incredibly helpful too. So if you can find New York State on the map, New York State is in the past 10 years really consistently ranked in the lowest 10 states for veteran suicides. So this is data from 2017. The data does lag by a couple years. So the most recent we'd have is 2018, but the only state lower than us in 2017 was Hawaii. That being said, within New York State, veterans still die by suicide at a higher rate. So if you look at kind of the left column here, it's showing, in the light blue, New York State suicide rate, and then in the green, the veteran suicide rate, and then comparing that to the rest of the United States. So there's really still a disparity between veteran rates of suicide and the New York State rates, the New York State general population rates. And this is a map of New York State showing the counties. And so, rates really can dramatically differ by county. So this is data from 2015 to 2017. So kind of our darker blue, so that's Livingston, Wyoming, and Columbia counties had the highest rates of suicide for veterans. And Erie and Suffolk counties had the highest number of veterans die by suicide. They also have the largest veteran populations in those counties. This is some information from our Erie County Medical Examiner's Office. So it wasn't finalized completely at the time of this. Sometimes they're still sort of closing out cases, but this is total suicides for Erie County. So it kind of shows on a year-by-year basis the count of suicides that we had. And what she noted from the 2020 data is that 14 out of those were veterans. So that's about 15% of Erie County's suicides. Sorry, this is like a busy one too, but on the left bottom shows our 18 to 34-year-old veterans. And so really showing just this increased and growing rate of suicides for the age group of veterans between 18 and 34, which is pretty alarming. So when we think about suicide, we very frequently think about the why of suicide, right? So, why do people complete suicide? Why do people have suicidal thoughts? And the answer for that is pretty complex. And it can be helpful too, as a data point, to also look at the what of suicide. So look at what methods people are using when they do complete suicide. So in New York State, almost 46% of veteran suicides were by firearm. And when you compare that against the non-veteran population, about 26% of suicides were by firearm. And when we think about, statistics that show that the majority of people who attempt suicide, so 71%, have thought about the method that they use for less than an hour. So sometimes the very act of a suicide attempt can be considered impulsive because of the amount of time someone thought about that attempt. And when you think about attempt with firearm, it doesn't take a genius to know that that would be a more lethal attempt. So when someone attempts by firearm, they're fatal 85 to 90% of the time, versus all other methods combined are fatal about 5% of the time. So when we're looking at suicide prevention, we really do want to look at lethal means safety. So things like safe storage of firearms. When we talk about medications, making sure that you're not keeping large amounts of medication in the house, and that we're really looking out for friends and family members. So that idea that we all have a role to play in suicide prevention. If I'm thinking about, firearms within my own household, not only is it wise and to keep them locked up and secured and to use, good firearm safety hygiene, but also in times of crisis, if we're going through something as a family or in a relationship, to make sure that that's even securely stored from someone who may be having kind of a mental health crisis. So what is VA doing when it comes to suicide prevention? Really quite a lot. So within the VA in Western New York, we have a full continuum of mental health services. We have a specific team that works with veterans who are higher risk for suicide. We do some work with ReachVet, which does predictive analytics for veterans with some complex care needs. We do suicide screening within the hospital, provide education on gatekeeper training for suicide prevention, sort of et cetera, et cetera. And this is where this new position for me comes in, is that those things are great and necessary, and all veterans are not served at the VA. So, veterans have really unique strengths and risk factors and also unique challenges, which can require some really tailored approaches or culturally competent approaches. So in New York State's Veteran Issue Brief, which is the place I got some of those maps from, it tells us that about 70% of veterans living in New York don't receive any care from the VA, not even, one benefit. And according to VA's national data, if approximately 17 veterans a day die by suicide, 11 out of those 17 don't receive any care at the VA. So, this is not probably news to all of you, but when we're looking at managing and having a true impact on, veteran suicide, we've got to be looking everywhere in the entire community. So we're moving towards keeping all of those things that VA was doing in a clinical way within the walls of VA and doing some outreach in the community, but also moving to this more community-based approach to suicide prevention. So essentially, asking members of the community, to really think about, are there ways that you're in your sphere of influence or in your town, your geographical area, and your agency, are there ways that you think that we could make an impact on, screening veterans for suicide risk, being able to identify members of the, veteran, military, and military family population? There are ways we can promote better connectedness, limit access to lethal means, or do education around lethal means safety, and even increase safety planning. And, I keep using the word coalitions, and that's kind of going over like a lead balloon in some audiences, but I really want to phrase it more as a team. So if you're thinking, yes, I feel like there is things I could be doing in my sphere of influence or in my organization to make an impact on the veterans that we're serving, what I'd want to do is ask you is, could we form a team, and really kind of work together on that? There's truly a lot of power in collaboration. And I've seen some of these coalitions really go a long way with the information and networks from all of the people that are a part of those coalitions. And just one example that I've been giving is, partnership with the Erie County Suicide Prevention Coalition. We have a lethal means safety committee. And so we've been committed to doing some specific training around lethal means safety within Erie County, providing veteran-specific, suicide prevention gatekeeper training, also distributing gun locks through the county outreach system. Then also we had one of our Master's Public Health interns create a map of Erie County that would show law enforcement entities and also firearm retailers that safely store firearms. So one of the common concerns that people have is, I don't want my firearms to be taken away, which I respect and appreciate. And in a time of crisis, that can be an added barrier, to not safely storing a firearm. So this map kind of gives detailed information about how much it would cost to store a firearm, what it would require to get it back when you're not in crisis anymore, things like that. So it's been a really nice partnership. So I know I've been meeting with some of you in other sessions, but would really love the opportunity to meet with anyone who may be interested in sort of forming a team and really thinking through how we could make an impact when it comes to veterans' quality of life and mental health care and suicide prevention. I know that was really quick because I was given a few minutes, but if anyone has any questions, I'd be happy to answer them.
Trey has a question in the chat box. He would like to know how he can directly connect and what are the next steps for joining the coalition team.
Yeah, I can put my direct email and phone number in the chat box so we can connect offline. I know there's a couple of other presentations, but I'm really looking to the community to be a little bit directive in this. It wouldn't be, I guess, proper for me to go into a community and say, hey, here's how we should do things. But I'm really looking to hear from, for example, I'd really love to start one geared towards female veterans, and to have a couple of female veterans sort of kind of leading the charge with a lot of support and technical assistance. And of course, I could do a lot of training, but really hear from members of the veteran community and military community about what would make a difference and how can we team up to kind of make that difference. So I'd be happy to put my information in the chat box.
Great. And also,
I have a quick question.
Oh, sorry about just if you can also share the video that you did with the Suicide Coalition, because I think it was a wonderful video. I don't know if it's ready to be distributed yet, but
yeah, it is a wonderful video. I know. So yeah, with the coalition, thank you, Kathy, for that. We had put together like a public service announcement video around suicide prevention and lethal means safety. And we had, veteran, one of our peer supports is in the video, law enforcement, some other members of the community. It is pretty much done, but we want it to link to some resources on the back end. So we're still working with the film crew to kind of finalize that. But once it is, I'd be really happy to share that.
Okay, wonderful. Bob, sorry.
Yeah, I was just wondering, and this is something that I hope to take into our breakout. If anybody here, Katie or others, are kind of following the findings coming out of the Operation Deep Dive study, because they're essentially have the same mission as this committee does, veteran suicide prevention. The story was Buffalo was involved with that for a while, then Buffalo was dropped as a site. But I've been following some of their reporting, and they have a lot of insights that would enrich what we're studying. So even though we're looking at our Western New York area, there's still some national things is that something, Katie, that you're kind of paying attention to, what they're discovering that would embrace what we're doing?
So this is the benefit of a team right here, right? Because I haven't seen the final report. And so I think, that's the benefit to kind of forming some of these coalitions, as you get information that everyone has kind of from the work that they're doing, to be able to kind of better guide the intervention. So I haven't seen any final report. I'd be very interested in that, Bob.
Well, they had some kind of interim reporting, and I was trying to read between the lines, and we'll take this into the breakout room too. But one of the general things is that community, you and I talked about this years ago, community education. Can you enlighten the general community to recognize the signs and symptoms of somebody heading in that direction, so that there can be what you're asking for is a team embracing and a team response to what may be a potential saving of a life. And so that's one of the things that's coming out of their thing. So maybe we'll take this into breakout in terms of what we're trying to do to generally educate the community, not just people here on our Zoom that are involved in the industry, but everybody, that's an interest of yours, I know.
Yes,
Katie.
it is. Yeah, thanks.
Katie, we can also put you in touch with Cherie, who's in charge of that study, so that you can talk one-on-one with her about that.
Wonderful, thank you.